I was a client here at Behavioral Crossroads, and it was here that I decided that I wanted to help people and become a counselor. I learned how to work on my behaviors. I learned how to mend relationships. When I came here, I didn't have anything. I lost everything. I hadn't spoken to my children or my family in 6 years. I came here through drug court, and my biggest support systems were drug court, Behavioral Crossroads, and 12-step fellowships, sponsorship, home group, meetings, and I rebuilt my life again. And with this money, I think the most important issues are to reach teens and young adults and educate educators on the signs of use through their curriculums on relapse prevention, coping skills, and mental health awareness, and making sure these students have been properly evaluated on co-occurring disorders. Also making sure the families are aware of and involved in what's going on with their children.
I just want to thank you, Tricia, for sharing your powerful story. And so, as you mentioned, it is important to increase access to treatment, especially medication-assisted treatment, because that is really the gold standard in terms of supporting individuals in their recovery from addiction. In addition to that, I think twofold is that we want to reduce barriers as well, and that was also part of our strategy. And so over the last few years, actually I'm pleased to say that New Jersey now has 47 licensed opioid treatment programs across the state of New Jersey, and they're present in every county. That didn't exist 3 years ago. So, it's a real great strategy in terms of increasing access to medication. One of the things that we've done recently is to look to expand the hours of operation for our opioid treatment programs. And so with resources that became available to us, we were able to increase the opioid treatment program hours of operation to 6 days a week and into the evenings as well. 2 of the 6 programs are located here in the southern region in both Atlantic and Gloucester counties. In addition, we've also looked to expand access to medication-assisted treatment in our mental health programs, because many individuals that have a substance use disorder are also impacted by mental illness. And so the extent to which our mental health programs have the expertise and the skill sets to assess and provide support and access to MAT within their programs, the better and the more individuals that we're serving here in New Jersey. And so with additional resources, we were able to do that in 4 mental health agencies. We currently have a solicitation to further expand that, and 3 of those agencies are again here in the southern region, Atlantic, Burlington, and Camden counties. We're one of the few states that have mobile medication-assisted treatment available. One of those providers are here in Atlantic County, and we're looking with additional resources to expand access to mobile treatment. So in areas where transportation is an issue, or with our mobile outreach, we're able to go to places where individuals who are experiencing homelessness can receive access to treatment. So we are in the process of doing that as well. We also have a strong partnership with harm reduction centers, particularly here in Atlantic County, with the Visiting Nurses Association of Central New Jersey and the South Jersey AIDS Alliance. We have partnered with them to work with individuals, to help to support individuals who they work with who are interested in seeking treatment and access to medication. And with that, it has been a very successful initiative where individuals who are receiving services at the harm reduction centers are also now receiving treatment for their addiction. In terms of reducing barriers, one of the strategies at the Department of Human Services has been to eliminate prior authorization for access to medications. So when individuals are interested and practitioners are ready to prescribe medications, they're easily able to receive that. And so what I want to mention is our addictions treatment helpline, 1-844-REACH-NJ, Reach New Jersey. And that's available 24 hours a day, 7 days a week. Individuals who are interested in accessing treatment, including accessing medication-assisted treatment, can call that line. Even for those individuals who are uninsured, they have access to treatment, access to medication through that line. We're able to support that access with state appropriations, as well as with some federal resources as well. And so in terms of access for individuals who are underserved in our state, particularly like in the Black community where we've seen, we have seen opioid overdose deaths, not decreasing at the extent that we see the broader population. We just awarded $750,000 to an agency, Family Connections, for them to provide on a statewide basis to all of our opioid treatment programs access to training, to coaching, as it relates to the integration of cultural competence. And particularly, they are going to be targeting how to access individuals in the Black community. And with that, also engaging them in how to support them in accessing medication-assisted treatment in the Black community, because we know that will save lives. And finally, one of the things that we've integrated in our division this past year is that with every solicitation, our applicants need to demonstrate how they are going to integrate the evidence-based cultural competency class standards in their programs. So cultural and linguistic access in their programs, so that moving forward, we can serve all New Jerseyans in the best way possible.
I'll start by saying, I started being impacted by substance use when I was a little kid, probably 7 or 8 years old, because I have many loved ones who struggle with substance use. But someone I love very dearly has been struggling for over 20 years, and she's not struggling necessarily because of the substance, but more so the systems that are in place that are meant to help her but don't. And so she's overdosed many times, unfortunately, but thankfully because of her friends who were with her while she was using, she's still with us today thanks to naloxone. And I'm really glad she had naloxone. For a long time we weren't able to necessarily get those resources as easily to people who actually use drugs. Traditional systems of treatment didn't really work for her, AA and NA, detox, inpatient or outpatient. It just didn't work for her. And she was never really offered any other option. It was really great to hear Valerie talk about medication-assisted treatment and the ways that it's being expanded in the state, because that's actually what saved her life in the long run. And she ended up being criminalized for her substance use. The first time she ever had interaction with anyone in terms of public service, it was to be put in prison. And she did not get help in prison either. She came out and she relapsed again, overdosed again, and she could not get access to care of any kind, housing, jobs, transportation, so much stigma on her back just for using a substance. We all use substances in this room. But recently, she was connected with Prevention Resource Network, which is in Asbury Park, and they didn't ask her to stop using drugs. This is the first time she ever walked into somewhere, and they were like, "What do you need?" And they gave her what she needed, which was safe-use supplies and testing for HIV and access to health care and offering of, hey, if you're interested, there's this thing called medication-assisted treatment, specifically buprenorphine. Actually, I think using the wrong term, medication for opioid use disorder, specifically buprenorphine, and she has been stable since then. And so I really do want to just name that harm reduction works, and it works way more than we give it credit for, because when we meet people where they're at, we give them power, right? And when people have power, the ability to act for themselves, they will make the right choices for what they need. So, and I just want to make it clear that I want to remind us that overdose deaths are preventable. And recovery is possible, whatever that means for the person, only if we give people the tools and only if we give people the power to do so. And right now, much of the treatment industry isn't doing that. So the story of my loved one I shared shouldn't be few and far between. And I know it's getting a little better day by day, but it shouldn't take so long for people to find the help they need. It shouldn't have taken her 20 years to get to a harm reduction center. And then in terms of making sure that people who are directly impacted have a voice in terms of how this funding is spent, we're here today having a conversation because drug corporations like Purdue Pharma lied to make billions of dollars at the expense of our lives. This is not at all uncommon to find someone connected to our organization at New Jersey Organizing Project who was prescribed opioids for some high school sport or some injury and then ended up struggling with substance use disorder because their doctor eventually cut them off. And we have other people in our organization who don't have that experience and who have come to substance use in different ways and for different reasons. And while it's key that we hold drug corporations accountable, and I'm really, really grateful for the Attorney General's work in securing this funding, we also have to recognize that we can't just create categories of who deserves help and who doesn't, right? And there are other systems that we need to fix, and I think we've mentioned them here, right? Like not arresting our way out of this crisis. There's legislation recently that came up that has a council for how the settlement funding should be used that includes directly impacted people. And I do think that's a really great idea, and I also think that that should be people who use drugs, currently and in recovery, and their loved ones. So that's the only way, because here's the thing. People who use drugs and people in recovery have been saying what they need for so long, and I just don't think we've been listening, because I think sometimes we don't like what we're hearing. And I think one way that we can make sure that people who use drugs survive and get access to the care they need is by expanding access to naloxone, medication-assisted treatment, and harm reduction services like syringe access and naloxone, for the ability to get for these services and for those services to get to them. So I would love to talk to you, Valerie, one day about mobile MAT in Ocean County and all across the state. So thank you so much, and I appreciate being here.
So yeah, my story is that I was a person who used drugs. I still am a person who uses drugs, but I was an injection drug user, experiencing chaotic drug use, or substance use disorder, addiction, whatever people want to call it. And for many years, I did not have access to sterile syringes. I had access to somebody who I was using with that I was sharing syringes. I didn't know anything about testing, about safer use, about the harms I was doing to myself. And that's not just about overdose. One of the numbers, one of the things that we don't talk about in that overdose death number, there's another growing number of people who die from skin infections, endocarditis, soft tissue wounds, sepsis, including 2 people in the past year that are participants of my program and people I care deeply. So I do this work in their honor too. And for me, I didn't know why I was continuously getting infections, and I didn't know any of that. And then I was fortunate enough to live in proximity to the Harm Reduction Center at Newark, NJCRI, and was introduced to their program. I had no idea. I wasn't there looking for anything other than, supplies, because in the early 2000s, I had no idea where, the pharmacies wouldn't sell them yet. And still we see problems with that. So I was fortunate enough to be introduced to that, and I had, as Priscilla explained, non-judgmental care. It was the first place I could walk in the door and nobody was trying to tell me I was wrong. Nobody was questioning me. People were asking if I was safe. People were asking, what do I need? And once I heard, what other things were there, maybe the first day I wasn't, jumping at the, excitement, filled with excitement to try other things, I was, I come to this from a place of trauma, and as a femme person who uses drugs, there's a lot of harms that come with that. So I wasn't trusting the first person to offer me care necessarily, but slowly that trust was built up just by people opening the door. We don't talk about sometimes when people are using drugs, people don't want you in their business. They don't want you using their restroom. They question if you're in their stores. And I've experienced that, and people continue to experience that. So to have a place that says, come exactly as you are, and tell us what works, because in harm reduction we believe that people are experts in our own lives, and no one had ever treated me that way. People had told me that my thinking was wrong, that my actions were wrong, that what I was doing was wrong, and harm reduction takes a neutral stance and just says, this exists, what can we do to keep you alive? And then what's the next change? What's the next positive change? And so the services that helped me the most were just compassion. I mean, we have, like you mentioned, all the physical services, access to new syringes, now we have access to naloxone, we have, testing, but really just somebody saying, you're not messed up, your brain isn't broken, you're not a bad person. And so for me, that was the most helpful, and it continues to be the most helpful, because I did enter like 12-step recovery, and that helped for me for a certain time. But what happened while I was there was I continued to see people around me who it wasn't working for. And those people weren't just leaving and coming back and hanging out. Those people were dying. And one of those people was my partner in 2014, and he couldn't fit that mold. He had been on drug court. He had been on medication-assisted treatment. He had been arrested multiple times. He had been homeless. He had been housed. He had been all of these things, and no one was willing to meet him where he was at. He was trying to fit a mold that he couldn't. And what I see, unfortunately, when we act as if abstinence is the only goal and stopping all drug use is the only goal, we set a standard that causes people to hide their use and use behind closed doors. And more than I can count on both hands, people that I love in my life have died behind those closed doors. So harm reduction continues to meet me where I'm at and say that I can talk about things going on. And I think just that is big. I wasn't able to say that to a lot of people in my life. And I also recognize that I'm in a position where I am now housed and employed, and I'm able to talk about that. And so I stand here also representing all the people who can't say that out loud currently. And I think that I'm going off on a tangent now, so I want to bring it back. Sorry. But and we applaud the Murphy administration, because this is the first administration that recognized, wow, we need to embrace harm reduction, because what we've been doing up until now isn't working. Continuing the punitive approach, people are dying. More and more people are dying. And we can't afford one single more person to die. We know these are preventable deaths. So, investing in harm reduction that is proved to work in other states, that has been happening across the country for the past 3 decades successfully, we're excited that New Jersey is catching up, that New Jersey now has an opportunity to treat everyone with dignity. Why not both? I always say to people, Why not everything? Harm reduction includes abstinence, harm reduction includes medication, harm reduction includes therapy and treatment, and it includes people who will never identify. The SAMHSA study was done that identified with people who are diagnosed with substance use disorder, at any given time, 9 out of 10 people with that diagnosis are not interested in treatment. Yeah. So then we know that's 90% of people who have the diagnosis, not even to mention the ones who don't, right? So I think more access, as my co-director Jenna Meller would say, a buffet of options. Yeah, reinforcing, investing in non-punitive measures, really seeing that we can arrest our way out of this, that increases in violence and poverty and homelessness and trauma and all the things that we've talked about with the pandemic are really doubling down when we're criminalizing this. And so to end, New Jersey's painful legacy of the drug war by creating systems of care is how we end the overdose crisis, is how we move forward. Really.